Hey guys, and welcome back to Only Mums. Today we have a super exciting episode for you about inducing labour after term, and we have joining us some experts in the profession: obstetrician and gynecologist Caitlin, midwife Phoebe, and labour and birth medical researcher Olivia. We will also discuss my own experience of my induction beyond term, and we'll talk about some different perspectives of what inducing a woman beyond term means, the risks and the benefits of this, and the current recommendations based on evidence. This is a huge and super confusing topic for many women, but also for professionals in the field, just because there's so much evidence that contraindicates with this topic. But today is just going to be a basic chat to give you guys some general information so that anyone thinking about induction can make their own confident decisions. So firstly, let's get stuck into what induction is all about. Phoebe, would you like to start us off?
Yeah, sure, Jess. Inductional labour is essentially when we start labour artificially through different methods. There are a variety of methods, but that topic is a podcast in itself. Today, we'll just, as Jess said, chat about induction as a generalized format. And the opposite of induction or alternative option is called expected management, which is just a fancy word for watching and waiting for baby.
Wow, I wish I was aware of expectant management during my induction. So over to our labour and birth medical researcher, Olivia. What research have you come across in relation to induction of labour beyond term?
Yeah, hi Jess. Thanks for having me. The current research globally suggests that induction of labour increases many risks, such as C-sections, retained placenta, postpartum hemorrhages, and also fetal scalp electrode monitoring. All these risks may deter women from opting for inductions. However, sometimes they are medically necessary. For example, the baby is growing too much or not enough and needs to be delivered earlier, or conditions such as preeclampsia, gestational diabetes, and postdates indicate that the baby may need some medical attention outside the womb. It is really a risk versus risk situation, as there are medical interventions that have a leg to stand on, but induction then brings its own risks to the table. Women should be well informed of the risks for both sides, such as making a clinical informed decision. I know today we are focusing on induction for post dates, but it is important to note that sometimes they are highly necessary.
Oh, okay. So keeping that in mind, now let's discuss what is considered a term pregnancy, or when and why is an induction offered?
Term pregnancy is a phrase used to describe a pregnancy that is over 37 weeks, and post is a pregnancy that goes over 42 weeks. Induction should be as close to 40 weeks as possible, with the safety of mother and baby coming first. Interestingly enough, there was recent research completed to redefine term. And it was found that babies' outcomes are really different in a positive way the closer to 40 weeks as possible. For example, 37 weeks, at 37 weeks, the risk of baby needing intensive care admission is double than that of those at 40 weeks. This study is called Every Week Counts and was by the University of Sydney, if anyone's curious. As Olivia stated, inductions can be medically necessary, such as small babies, large babies, and maternal conditions, and also maternal welfare and mental health. Just a question for you, Jess. How was your induction managed and discussed?
Wow, thanks, Phoebe. I felt really well informed about the medical reasons for an induction of labour, leading up to and around my 40-week gestation mark. The doctors explaining that the placenta gets old and tired, which can impact the well-being and nutrition given to my baby. I was also informed about the increased risk of fetal death in utero, which made me feel as though an option beyond term was my only option. It was really, really scary. I was never really told about the risks of induction, only that there was going to be a date made for a plan to induce me at 41 weeks and 5 days.
Thanks for sharing that, Jess. That's an interesting point. Can I ask, did they do any extra monitoring on your baby, such as monitoring your baby's heart rate and checking how much fluid was around the baby?
Yeah, they did do a few monitoring checks and things like that. However, I feel that Many women feel as though they don't have any choices with inductions. A qualitative study, for instance, it was published back in 2021 about women's experiences of elective late-term induction of labour. In that paper, many of the women interviewed in the study said that they would have preferred that they had been given a little more time to decide. They wish that someone had said, you know what, this is not the only option. You can go home, think about it, come back tomorrow, or had been told that when you are induced, there are lots of different things that can occur and there are risks to that as well. So Dr. Caitlin, could you maybe share the medical perspective and some of the evidence around this?
Yes, absolutely. So in the obstetric field, we often offer inductions beyond term to women to reduce potential harm to both mothers and babies. This is something that has been reflected in recent studies, and a randomized control trial that I'll refer to is marginally in favour of the induction process, which is why you may often hear of doctors advocating for induction for post-dates pregnancies. Induction for post-dates is a new phenomenon, whereas 30 years ago the term didn't even exist. A term pregnancy was simply classified as being between 37 to 42 weeks.
Very interesting, Dr. Caitlin. I actually have been researching a quantitative article from Austria that I've studied, and it demonstrates that the rate for induction of labour has actually increased every year due to the increased popularity from hospitals and obstetricians. Comorbidities also play a factor as they are more and more common. However, the indication for induction just being post-dates remains a major risk factor for increased negative outcomes for women and their newborns. This article includes many women over a 6-year period, which really highlights the risks as the cold hard evidence displayed that women that have had inductions for just being term had more incidents of retained placenta, which then led to postpartum hemorrhages. There were also incidences of increased C-sections, which is quite traumatic for women as it is major surgery, and most young women have never even had a medical procedure performed, let alone major surgery.
Thanks for sharing your perspective, Olivia. As a medical professional, we unfortunately are exposed to some of the adverse outcomes associated with the expectant management of labour, as opposed to induction of labour at 41 weeks. Something that I've seen in my practice and that is also reflected in research is that meconium liquor, or when baby does its first poo inside the uterus, is less likely in women who are induced at 41 weeks. We've also found that perinatal death, low APGAR scores, and NICU admissions are all less likely with induction post-dates. However, caesarean sections rates are slightly higher in induction groups. I know that this is a lot of information to process and may be overwhelming, but overall the research is showing that there are marginally greater outcomes for mums and bubs when they are induced at 41 weeks. However, in saying all of this, similar to what Olivia mentioned, I am aware that unfortunately women that fall under medical or obstetrician-led care often have higher rates of intervention, such as caesarean sections. And this seems to be avoided more so in groups of women who remain under a midwifery care model. So that's something for women to consider when choosing their model of care.
Wow, that's a lot of evidence to consider there. Very interesting about the NICU admissions and those APGAR scores with perinatal death. Just something that I pricked my interest was it interesting that caesarean rates have increased in induction groups in your research, Caitlin, as other sources state that caesarean decrease in the induction group. I believe this highlights the trust we hold in minimal differences between induction versus waiting for a baby, waiting for that spontaneous labour. The stillbirth rates between induction and expected management is 0.4 to 3 deaths in every 1,000 births. Therefore, it is essential that we treat every woman as an individual and what her body is telling her. And just to clarify, post-dates are considered and discussed after 41 weeks in most tertiary hospitals. This term post-dates further reinforces the medicalisation of pregnancy and labour to specifically time when a baby is born. Post-dates should not be the sole reason for induction. Caitlin, do you think this conversation should be facilitated earlier so that women have more time to process and make a decision?
That's a really great point, Phoebe. I feel like all options should be discussed in the antenatal period so that women are able to make informed choices early in their pregnancy, as opposed to right when decisions need to be made at the post-dates mark. Jess, how would you feel about receiving that information before you were term and during your pregnancy?
Yeah, there are so many other things to think about during pregnancy. Some women in the qualitative study I mentioned earlier even said that it was a good thing not to speak about inductions during pregnancy because there are just so many other things to think about and keep you occupied during pregnancy. They believed it would have been a bit of information overload to hear about induction of labour. However, for me personally, I wish I had been more informed about the actual process of induction, such as the chemical and mechanical ripening of the cervix, the risks involved with the oxytocin drip before my due date, just so I could feel a little bit more comfortable in the process and confident that what was being done was going to be beneficial for both me and my baby. I also had a question about the impact on the baby, as I had a situation where I felt really uncomfortable when the midwife said that they would need to put a needle into my baby's head to monitor baby when I was in labour, which I now know was the fetal scalp electrode. So, Olivia, do you have any research about the benefits and risks of monitoring babies during inductions?
First of all, I'm so sorry that happened to you and you felt that way. But yes, you are correct. There are benefits and risks for mothers and their babies. As you mentioned, there are increased rates of fetal scalp electrode monitoring, as monitoring via CTG is actually policy for most hospitals during an induction. Due to the unreliable nature of the ultrasound component of the CTG monitoring, though, many midwives make the decision to attach a fetal scalp electrode to the baby's head. For those at home who don't know what it is, it's basically a wire that has a little hook on the end of it that gets coiled into the baby's scalp just under the skin to be sure that the heart rate that is being picked up is baby's. Although they provide a constant monitor of the baby, they also come with a risk of infection. Additionally, newborns also have an increased risk of being admitted to NICU for respiratory distress, as induction can actually cause the fetus to become really distressed.
Wow, some interesting points about how bubs can be impacted as well. Phoebe, you mentioned earlier about expected management. Is expected management considered as an option, or is it not recommended by health professionals?
Yeah, considering all of these facts, as a midwife, we often see that women aren't given the choice to continue with expected management. This may be due to increased medicalisation of childbirth, or in your experience, you felt pressured into making that decision. As said earlier, there are increased risks for mother and baby for going beyond 42 weeks, but it should be assessed case by case. Emphasising the importance of tracking and knowing your fetal movements and increased monitoring, such as amniotic fluid assessments, just the water around the baby. And as Caitlin was saying, some heart rates for baby as well. It's a great alternative rather than pressuring women into induction. Women must be given all the facts for both in order to make informed choices without risk of coercion. In saying all of this today, if women out there have had an induction, that is also perfectly okay because it was your choice. Well, I hope it was. And at the end of the day, as long as you and baby are happy and healthy, that's all that matters.
Exactly right. Well, thank you all for joining us today and providing such an interesting insight into what induction is, what it's all about, the process. It's certainly given myself and all of the listeners at home something to think about. But the main message from today is, and I think everyone will agree on, is that induction beyond term is 100% the woman's choice. And we should all be empowering women with the knowledge to make their own decisions. I think this has been a really great chat, guys, and I hope to catch you all next week to tune into Breastfeeding 101. So see you then. Bye.
Bye.
Thank you. Bye.